أهلا وسهلا. Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome everybody to our next episode, Enriching Talks with Hafsa. This is Hafsa Qureshi with you. Um, Today is Wednesday, 28th of January, and we are less than a month away from Ramadan. So this special episode comes with preparation for Ramadan, inshallah. So just as usual, doing a little introduction about myself. My name is Hafsa Qureshi. I am a certified childbirth educator, lactation professional, and a newborn care specialist. A lot of you know me already. I see lots of my moms here as well. And reviewing the mission and vision behind these talks. Today is the 14th episode. So I think we started almost more than a year ago. And basically, this is not your usual talk show. This is where I bring in special topics, special speakers, and today's one is very special. I'll be introducing her in a bit, where we discuss different kinds of birth stories, topics, educate you guys, support you guys, give you guys guidance on where and what you need. All right, so this is the vision and mission behind these talks. So without further ado, I would like to introduce Aya Samara. Now, Aya, I'm going to let her tell her technical stuff, but the first introduction I have about Aya, which many might not know, is that I know Aya from my childhood. Subhanallah. We went to school together, literally. And mashallah, she's grown and she looked at, like, I mean, I'm just so proud of her, mashallah. And we literally grew up together from primary school all the way to secondary school. We graduated high school together, and then we kept on off in touch as well because she happens to be in Kuwait also. So, and mashallah, look at the work she's doing. She is a dietitian holding a master's in clinical nutrition. And I thought, wow, why not invite her? No better person to talk about this topic than Aya. So, alhamdulillah, she was available in her busy schedule. So I was really blessed that Aya said yes, she can. So she's done a lot of work behind women health. Like she works with women with PCOS. She works with them in pregnancy, in general weight loss. So much. She just does so much when it comes to evidence-based clinical nutrition guidelines for the parents and for mamas specifically, and women, which we all need, I think. Subhanallah. And across all life stages, literally. So we are today going to be addressing fasting during Ramadan from an evidence-based perspective, as well as culturally and Islamically as well. So what do you call it? Aya, I'm going to let you go ahead and give yourself a formal introduction, and then we'll jump into the topic.
Thank you so much for your introduction, Hafsa. And it's really happy to be with you today, just because of course, of our shared history. So I'm almost so proud of you and what the work that you have done, and it's
Thank
just
you so much.
I'm so grateful that I am one of your in one of your talks in these episodes. I'm so happy. So, like Hafsa introduced, I've been working as a clinical dietitian now for like 16 years. And for the past almost 10 plus years, I've become a women's health dietitian. So I work with women through every phase of their cycle, from when it starts till it stops, and through every phase that they go through, from fertility to pregnancy, breastfeeding, and postpartum, perimenopause, and menopause. So we go through the whole thing. And yeah, today's talk is really important. Ramadan fasting and pregnancy. It's something that I get asked a lot about. So I'm really happy to be here and to answer any misconceptions about evidence-based, what's happening, what should be done. So yeah, I'm looking forward for this talk today.
Yes, thank you so much. And yeah, like you said. So I'll just jump right in. And of course, at the end, we'll keep like 5-10 minutes if anyone has any other specific questions. So I'll just jump right in. So as a clinical dietitian, how do you approach this topic if women comes to you? I mean, we're doing this talk here, but
Yeah.
if a woman comes to you about Ramadan and pregnancy, how do you approach it? What's your first answer to her, basically, in your clinic?
So usually what I do, first of all, I need to medically and nutritionally assess her before we start anything, before we even have a talk on why she wants to consider fasting, if it's a personal reason, if it's like a cultural reason or family pressure, it's just her own need to kind of fast during this month, I need to make sure that she's medically cleared by her doctor to fast, and then nutritionally cleared and as in the nutritional status. So she's like, if she's anemic or if she's got blood sugar issues or hypertensive, or so we have to look at her and her BMI, her weight gain, what part of her pregnancy she's in at the moment. So we have to assess her, and then we decide to go on from there to continue the talk.
Yes, I think that should be the right approach, like an individualized approach rather than a
Yes.
general one. Right. So next would be, when we look at available research on Ramadan fasting in pregnancy, what do we know so far, and what are the limitations to this research that you feel, especially living in a
Yeah,
Muslim country?
so the problem with fasting and pregnancy, there isn't a lot of research on it, and the research that is available isn't the best quality research. So isn't it's done on a very small sample size. There isn't a lot of control on the studies themselves. So they're not the best studies out there. And other than that, the results are very controversial. Like they're very confusing. It's because you get some research saying that the fasting does affect baby's birth weight. It could affect with placental insufficiency. But then there's a lot of research that says that it doesn't. So it's just kind of in a way contradicting and confusing. And the type of studies are not the best. Plus, a lot of these studies are done through questionnaires because it's not very ethical to do studies on pregnant women. So it's done
Or
on
no,
questionnaires. Women ask. So a lot of these studies are just people, like women kind of doing questionnaires. It's not well controlled. So that's why when we look at a woman who comes into our clinic and wants to fast, it's very individualized. And yes, we do use some evidence with it, but the evidence isn't very strong. So we look at each woman and we look at her own medical nutritional status, and then we personalize a plan that will work for her.
makes sense. Yeah, definitely makes sense because, like you said, no woman was going to allow herself, and I face that with medications and things when mamas come to me.
Yeah,
I'm like, no woman is going to allow herself to be the lab rat, basically, right? In pregnancy,
exactly.
that no matter how much you pay, right? Um, all right. So this is basically brings me to the next one, which is what you just said, that in fast in Ramadan and in pregnancy, it's not one size fits all, right?
It's true.
How would you, from a nutritional and more of like the metabolic like functions and everything happening in the body?
So, pregnancy in general, there's a lot of dynamic metabolic changes that's happening in that woman's body, and it's completely unique to that woman. So, every woman, and even the pregnancy. So, what happens in one of your pregnancies would be different in a different pregnancy. So, I see this a lot. Some women were like, oh, I fasted when I was pregnant the first time, and she was probably like in her early 20s, and then she got pregnant again, maybe mid 30s. She has a different metabolic, there's metabolic changes that happen in those 10 years. She's a different woman, and it's a different pregnancy, and it has different needs. So we have to look at it in that sense. It's completely personalized, even to the pregnancy, not just to the woman herself.
True.
So when we look at nutritional status, we'd be looking at her BMI, we'll look at her blood work, so like her iron levels, her vitamin D levels. Is she having any issues with her glucose? Is she hypertensive? Her hydration levels at that time? Is she drinking enough fluids? Is she dehydrated? And then it's very important to look at medical conditions. So if someone has like an autoimmune disease, if she's has to be on certain medications that are taken at certain times during her pregnancy, like she can't fast. We have to look at every single aspect in order to make the right decision when it comes to fasting during Ramadan.
Yeah.
And
And what would
honestly, some women adapt really well to the fasting and some don't. So again, some women kind of try it and then we don't see good results and we have to stop, and we'll talk about those later. What are some of the things that could happen? But yeah, some adapt really well and some don't. So it's really individualized to the pregnancy itself, even, and to the woman.
Yeah, subhanAllah. Exactly. Yeah, especially like she could have any specific conditions, like you said. And what would be like, what would be the nutritional or medical red flags would make it unsafe? Because I think that's the most common question I got. How would I know I can or
Yeah.
I cannot fast? apart from like obviously seeing a dietitian and getting an evaluation done, but any
Yeah.
specific if a woman is winging it, what are the red flags?
So I'll tell you one that just happened 2 days ago in my clinic. I had a client come in, and she's around 8 weeks pregnant,
Mhm.
and she was considering fasting. She came in, and then she was telling me that she's very nauseous. She's having morning sickness. But then when I asked her a bit more about it, she said she hasn't been able to eat any meal without throwing up. So it's no longer just morning sickness. It is,
All day.
yes. So she's having a medical issue right now, and she's completely dehydrated. She's undernourished, and she hadn't told her doctor about it. So when she told her doctor, she just said, I've been throwing up in the morning, and she didn't tell her doctor about the rest of the day. So when I was going through her day and her intake of our food was almost like 500 calories, and she was throwing up most of it even then. She wasn't able to drink water or fluids. So in that sense, this is someone who should not be fasting. So that's one of
Definitely.
like a really red flag.
Yeah.
Another thing, you have to be very, very honest with your doctor. And if you are feeling anything off, you have to let your doctor know. So if the patient is anemic, so she has low iron levels, she's feeling extreme fatigue. We're not talking about the normal pregnancy fatigue. We're talking about extreme fatigue. That's something that you need to consider. If the patient is diabetic, and not taking care of her blood sugar, so she could actually have hypoglycemia when she's fasting.
True.
She has thyroid issues. Sometimes polycystic ovary, like with some women, it causes metabolic stress when they're fasting, and even women who have insulin resistance, it could actually not help them to fast during Ramadan.
Yeah.
Um, Women who are underweight. So if
True.
you're already underweight, you're not gaining enough weight during pregnancy, we have to look at that. Dehydration. So if you're looking at you're not going to the toilet enough, your urine color is very dark, you're feeling
Yeah.
headaches, tired, those are signs that are not okay during fasting. And for some women, like they have placental insufficiency, don't have, like, when even when the doctor checks with their ultrasound, they feel that the circulation isn't good. It's just because the woman needs a lot more fluid and she's not getting that while fasting, and this is a health risk for her and the baby.
Yeah.
But
Definitely.
yeah, I would say one of the two main things, if you're very nauseous, not able to keep any food down, and dehydration, are two main things, because they're going to be the cause of the fatigue and all the other issues.
Yeah. And I think in the first trimester, like majority of the women have, if not all day nausea, like not hypermesis, but they would have
Yeah,
um, a significant amount of nausea. And if you are
exactly.
empty stomached, if you're like, if you don't have like, you're just regurgitating acid, and that can result in heartburn as well. It just becomes messy in every way possible.
Exactly.
Yeah.
It's true.
Yeah. Definitely. Yeah. No, I think these are very important things that I hope all the mamas are listening that are making note of these things. Right. So, when you monitor the nutrition, if a woman chooses to fast, basically, so
Yeah.
what would you be focused on? I'll come to what like the meal choices is the next question, but
Okay.
what would you be focusing on nutritionally? Like what, like would you do like blood work or
So
something to see pregnancies? How do you do
number
it?
one, number one, of course, we'll do a medical nutrition assessment. So we'll look at her BMI, we'll look at her blood work, we'll look at her eating habits. And then when she comes in for her follow-ups during, if she decides to fast, we're going to make sure that she's looking at her hydration. That's number one. So she's getting enough fluids. Is her urine color normal? Is there fatigue? Is she getting tired? Things like that. Second, we're going to look at, like, if she's eating enough calories, because the problem with fasting, you need a certain amount of calories when you're pregnant. But when
Right.
the eating window in Ramadan is quite short. So we need to make sure that she's getting enough calories for her and for the baby during that time. So we'll check that with follow-ups. And then we'll make sure that she's not losing weight significantly. The baby's gaining enough weight. And then the doctor would also check baby's growth, baby's movement. Those are very important.
Definitely. Yes, definitely. So, and you would basically be working hand in hand with their obstetrician, or you would tell them that these are things you need to go back and forth with.
Exactly. Yes. I always like to work with the doctor himself. However, if the doctor isn't available, I would like tell the client certain things that they need to check with their doctor to make sure that everything is fine.
All right, that brings me to the next most asked question. So, if a
Yeah.
pregnant woman is medically cleared to fast, what would her suhoor and futur look
Mhm.
like? So, start with suhoor first. What would be some ideas so these women can
Okay.
jot them down of possible things that they could have, which would help in this?
So first thing, it's really important to not skip any meals because I see a lot of women, what they do, oh, I'm just having one meal a day. I can't eat anymore. I'm not going to have suhoor. Suhoor for a woman who's pregnant, in general, suhoor should be a main meal. Like it shouldn't something people skip. It's very important. But if you are pregnant and you decide to fast, it is a non-negotiable. You have to take your suhoor. So that's number one. Okay. And then when we look at suhoor, it should include three main things: a fat source that's healthy, a sugar source like a carb that is high fiber, that it can give you sugar and energy throughout the fasting, and a good protein source.
Makes
So it
sense.
could be something as a rice, chicken, vegetable dish. And it can be something as eggs, avocado, bread with vegetables. It could be like a breakfast meal, or it could be like a lunch meal, but it should include those three things: the protein, the carbs, and the fats in the right
Hmm.
quantities for each woman because it's individualized, honestly. It could look like a breakfast meal, it could look like a normal lunch meal, but the quantity has to be enough. So it can't be like, oh, I just had two bites of rice and a bite of chicken and some like a little bit of olives and that's it. No, you need to be eating a good full meal and you're full, so that gives you energy throughout, so that you're not fatigued and you're not tired. And for me to make sure that you're getting enough calories because you're only getting two main meals
Yeah.
and maybe a snack here or there. So that's why I need to put all of those calories that in those two meals. So it has to be nutrition. It has to be very nutritious. And then when you break your fast for futur, of course, I always love starting with dates, maybe some laban or like a drink that has a little bit of hydration and salts. So it could be an electrolyte drink if you want, and it could be
Right.
laban. I find laban one of the best things that you can have with some dates.
Right.
You can add a little bit of nuts or like a little bit of almond butter or peanut butter, so you know you're getting some fats in there, and also you don't get like a sugar spike. And then
Right.
the next meal, like the meal itself for food, should also have a good protein source, a good carb source, and some fat. So that could be, again, something like a little bit of meat with rice and some vegetables, because the meat itself has fat. And then it could be like a chicken with rice and vegetables. It could be like a tharid, which is like a stew with meat and vegetables and a little bit of bread. I like making sure that the meals are very nutritious, so you're getting all the nutrients you need. So I prefer women not waste their time with snacks like sambusa and like eating snacks before the real meal because then
Hmm.
they're gonna get full and they're not gonna get the right nutrients. So have the dates, have the laban, have a main meal that is filling and is very nutritious, and then we can think of like extra snacks, like one or two, some desserts maybe, just like a few teaspoons. But everything you eat has to be very nutritious, getting you enough calories and giving you enough energy at the same time.
Yeah, definitely. And what's your opinion on basically distributing the meals? Like if she does smaller meals, but
Yeah.
from basically Maghrib all the way till I don't know. Like I mean, we want her to sleep as well, but if she's awake in the night, so because I mean now it's winter Ramadan, alhamdulillah, finally,
Yeah.
but when we had shorter nights. So what about splitting? Like you said, you assign the number of calories and then we split them. How's that?
Yes. So usually we split the calories between suhoor and iftar. Iftar can be split into like two meals because some people can't eat so much when they break their fast. So we do like the dates with laban and maybe a soup dish. The soup dish should also be quite nutritious, have vegetables, a little bit of protein maybe. And then like an hour or two later, she can have like her full meal. And then we can do a snack, but the snack itself again would include a carb, a protein, and some healthy fats. So that could be something like a yogurt bowl. You can have some Greek yogurt with some berries and fruits and a little bit of like almond butter or like some nuts. So that way she'll have like a good nutritious snack. And then you'll have suhoor. And some people, if they're staying up, they can break even their suhoor. So they can have the first meal and then just before dawn, like before they start their fasting, they could have like some dates or a banana or again sablaban, something to help them with the next day. That's why I'm saying it's completely personalized because it depends on the woman's eating habits, sleeping habits, family habits, and then we personalize it for that case. And then again, if we decide at some point, oh, she shouldn't be continuing her fast, we also change it up, you know?
Yeah, yep. I totally understand that. So these are the key nutritional tips. I love that you said about the carbs, the fat, and having the protein in it as well. And yeah, I was going to ask for you an example of a diet plan, but I think you gave plenty of examples here, samples that
Yeah,
should
the main
be.
thing that whenever, so I think like a main thing that all of these women should note when they're looking at their plate, they want to make sure that they've got these nutrients on the plate. If they've
Mhm.
got it at every meal, at iftar, their snack, and suhoor, then at least I know that there are nutritionally and energetically they've taken their needs. But if let's say she's just taken a big plate of rice, there's no protein, there's no fat, I know there's something is missing. There's no vegetables. So as many colors as possible, as many variety as possible, then that means that she's getting the nutrients that she needs for the pregnancy. If something, so that's why you look at your plate and make sure that you have those three things every time, then you're going to be on the right road during that pregnancy and the fasting.
Yeah. What about hydration? Is there a specific number of liters of water or something do you recommend?
So our, of course, hydration is higher during pregnancy, and that's where the main issue happens during Ramadan. Um, for a normal person who's not pregnant, they need their weight times 35. That will give you around, for most people, it's 2 liters, 2.5 liters. For pregnant women, it can go up to 3 liters. So that's quite difficult to get from
That's what I'm
the
thinking.
time you fast, you break your fast to suhoor, especially if you sleep or you have a nap in between. So I would suggest, other than just making sure you're getting enough fluids, getting electrolytes. So maybe like coconut water, putting some salt or and lemon in your water, making sure you're getting fruits and vegetables because those also are hydrating, having soups,
Oh
herbal
yeah.
drinks. So getting your fluids in different ways. So it's not just boring and you're chugging water in it because as when I was pregnant, I couldn't drink water that much. It was very difficult to drink the water, and especially in the beginning of like the first trimester. And sometimes the water feels very heavy. So you want to make sure you're hydrated, but doing it in different ways. And there's like you can have easily lettuce. Lettuce has a lot of water, you know. Strawberries, lots of the fruits and vegetables have so much water in them. And you can do like vegetable juices, maybe like a celery juice, something like that. And it'll also help with the hydration and electrolytes because you don't want to be losing, you don't want to have so much water but not have enough salts even. So that's why we talk about electrolytes because a lot of the times when you're fasting, that's what you lose. You lose your electrolytes and what gives you like the weakness and the fatigue and the headaches. It's a lot of the imbalances in salts that happens.
Yeah, I think even us, like I mean, I'm not pregnant, you're not pregnant, with the
Yeah,
non-pregnant women, we need the electrolytes
exactly.
as well.
Exactly.
Uh,
It's true.
we're like, I specifically remember that whenever I would have something very sweet in futur, I get a headache, and
Yeah.
it's annoying me because I'm like, okay, tomorrow I'm gonna be better. And the Leban idea is the best, so something which is healthy as well at the same time. I love the Leban
Yeah.
idea you gave.
The thing
Subhanallah.
is, with having just a pure sugar after breaking a long fast, a lot of us get a like like a high spike in our sugar, and then there's a drop, and that gives you like fatigue and a headache. So that's why it's important to kind of add dates with a leban with a protein or a fat, so you don't get that very high spike, but you still get the energy that you need from the dates and the
Yeah.
sugar.
What would you say about all these fried stuffs? Because I just feel Ramadan, all of a sudden we're making things we don't really normally make.
Exactly. We
Like,
don't usually eat or need.
yeah.
That's what I said. So if you're, so what I see a lot of the times, um, people would start their fast with like they break their fast with dates and leban, soup, and then have so much fried food that are lacking in every nutritional. They have zero nutritional value. It's just a lot of fat, fried bread, and very little protein, which I understand people crave it. So that's why I'm saying have your main meal first, make sure you're covered in that sense, and then maybe have one or two of those just because you're craving them,
Right. Yeah. And just
but
to
not
just
start your meal with them.
right, just to fulfill the tradition for the sake of the tradition. I just feel the tradition
Just for the
takes
sake
over.
of the tradition, yes.
Subhanallah. Yep, 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 exactly. And all right, now let's, I mean, thank you so much about this, the nutritional aspect. And then we will take some questions if people have them. What about the emotional? I'm sure you feel a lot of like people affected by emotions, which affects their nutritional guidelines as well. Because some people feel like guilt or pressure about not fasting. So, as a mother yourself, who's probably, seen Ramadan either in pregnancy or while
Yeah,
lactating, and as a professional, like compassionate lens of your eyes, how do you help women with this, the health and then the faith? I mean, yes, alhamdulillah, Allah has given us the ease. Like every
yeah,
pregnant woman has the ease, and I'm sure all the pregnant mamas know that. And if not, this should be a reminder for you guys that if you
yeah,
can't for any reason, it is okay. But when you, in like Aya, in your like perspective, and you get women, they're like, oh, but there is pressure to either fast or the
yeah,
complete opposite, that no, like she can, but she's told not to fast, which is more
yeah,
rare. I think the pressure is more on the guilt part.
yeah. Yeah, most women are guilted into fasting and they feel ashamed if they're not allowed, like if they're not fasting, due to cultural reasons, family. Honestly, with religious reasons, women are exempt and they are allowed to not fast during that time and they can make it up later.
Right.
And I always tell them that. But a lot of them feel left out and a lot of them don't want to make up their days later. They
This is
feel
the
like,
biggest.
oh, I'm pregnant, I don't get my period, so I can fast. But if she's if it's a health risk, we I can't be pushing her to fast, you know? And I
Right.
always tell the woman, it's your decision. It's your decision with your doctor, and then again with your healthcare team. It shouldn't be your mom's decision or your husband's decision or family decision. And I know the family pressure is quite strong, but when it comes to her health and the baby's health, that's the most important thing that she should focus on. So I always try to remind them of that. And if women are able to fast, so if some women are able to fast, but then during their fasting they feel tired or they have to stop it sometimes. So we sometimes come to like a decision where she doesn't have to fast every day. So she can fast on and off, one day, one off. Some women feel ashamed to eat during the day when everybody else is fasting. So she ends up not eating, but just
And
drinking water, but still it's the same issue. So we have to find a middle ground that works, especially if she's allowed to fast, a middle ground that works for her. Um, but there is she can have the meals by herself, or she can have snacks throughout the day, and then she can have the main meal with the family, so that she doesn't feel left out. And a lot of the times the women feel some sort of stigma. They feel like they're not part of Ramadan if they're not fasting. They feel like they're
right.
missing on a very important part because you don't feel the real essence of Ramadan when you're not fasting. So I try to tell them from beforehand to kind of have a list of things that they can do to feel connected. So they can
Oh,
like practice, they can read Quran, they can like do zakah, they can do some charity work, they can do things that makes them feel connected even if they're not fasting.
huh.
So
Yes,
that
true.
helps a lot because it just helps them from the whole feeling of guilt that they're not part of the process. And they're doing something great. Like they're not just like lying around, they're making a baby, they're making organs. And I try to remind them to look at their weekly thing and see what organ they're making today. What more organ are they making this week? Because they understand the importance of what they're doing. It's not just they're not fasting for no reason.
I love that. I think that is an excellent tip. Like a woman should have. I mean, we have those tracking apps which shows
Yes, the tracking app, exactly.
what part of the baby is developing, and I think that's very important. And plus, what I tell them that this whole wahnan ala wahn, like this whole pregnancy itself is ibadah.
Yeah,
Like your constant state of ibadah.
true.
You're getting rewards automatically. So
Exactly.
it's automatically happening. You're right. And I feel like I hope if there's any mother or grandmother or family member listening, it should be the support we should be giving the mother, right? That don't pressurize her to fast if she's unable to, and
Yeah,
don't deprive her if she can. Like, don't tell her that you're pregnant, you shouldn't, if she's been cleared by a professional who said that she could try.
exactly.
One thing I wanted to, which was I was wondering about, is per trimester. Like, I know you said it's very
Yeah,
individualized according to each person, but what I feel, and personally as well as professionally, the first trimester is usually the hardest for a woman to fast because of
yeah,
everything she's going. I think things do ease in the second trimester and
true.
third trimester. My only reservation, I mean, it's easier for me, and I have a workshop on this tomorrow for breastfeeding and fasting, but it's easier for me in that aspect because we can see, like, immediately we see the results. When you're not feeling the baby move, when you're not
Yeah,
sure how the baby's doing, it's very hard to gauge, is the fasting impacting you or the baby, right? In
very true.
pregnancy, that is.
Yeah.
So I would say that wait at least, like, you're in your second trimester if you
That's what we
want.
usually recommend. That's true.
Yeah,
That's what we usually recommend. Because the first trimester is usually also when a lot of the main organs are being made. So you don't want to be nutritionally deficient in any way. A lot of women already suffer from morning sickness, and morning sickness gets worse when you stop eating. It just
right.
gets worse. That's why you should have like small snacks every 2 or 3 hours. So you're not going to be able to do that if you're fasting. um, and and a lot of the times the first trimester is quite exhausting and causes a lot of fatigue for women. Their energy starts coming up in the second trimester, and the second trimester is when you start kind of feeling the baby move. So if there's any issues, you can feel it right away that's happening. So yeah, we don't usually recommend the first trimester. We want women to kind of make sure they're getting enough hydration, getting enough nutrients in that sense. Second trimester, it depends again, case to case, but most women are able to fast. And then the third trimester also depends case to case because it's a quite a you need a lot of energy. So your energy needs are much higher in your third trimester. So sometimes women are not able to get all the nutrition that they need while fasting. And second, it's quite exhausting. It's quite energy demanding. So it depends when you are in the third trimester. So if you're in the last month, it's quite difficult.
Right.
If you're early, like around the seventh, eighth, maybe something like that. So it depends when you are in the third trimester. And again, it's a case to case basis.
True. Yeah, I agree. And I think a good assessment from a Muslim doctor would be the best option for moms to know,
Yeah,
specifically, sure, and get like all the stuff that I talked about. Like, look at how they analyze it in the clinic. I was very impressed. Like, they look at your BMI, they look at your blood work, they look at everything and assess you. And I think that makes sense to help us make that decision as well, inshallah. Yeah, definitely. And the third trimester also, like, sometimes fasting could cause cramps, and we don't want preterm labor as well, right?
exactly. Yes.
So hydration and then the extra calories you need that you just mentioned, that's very, very important. Yep, definitely. We have the last like 15-ish minutes. So
Yeah.
I do see questions popping in, but before we go to the Q&A, I just want to ask, is there any takeaway you want them to, like, anything you want to say that you feel is important, that message that you want pregnant women to take away, whether they decide to or not to fast?
Food is fast. So I want them to take away that the decision is very personalized. So not to listen to, oh well, my cousin fasted, or my sister was able to fast, or my mom was able to fast. It's personalized to you and your case and this pregnancy. So even if you did fast in another pregnancy, it's not the same. It's a different body, it's different pregnancy. And then the decision to fast should be done first by you if you want to fast, with your doctor, with your healthcare provider, and you get a clearance medically and nutritionally. And I always prefer that these women do get at least one consultation with a dietitian to let them know what to do. So, and they can just give them a meal plan for the beginning, and then they can continue with it. And then maybe do 1 or 2 follow-ups, or at least just have a plan so they know what they're doing and what to look for and what issues that could come up. So that's very important. And then the most important thing is the baby's health and your health as a mother. So don't feel pressured if you're not able to fast. At the end of the day, you are doing enough when you're pregnant, and your health, your nutritional status, and that should be the main thing. That should be your main kind of takeaway from all this.
Yeah, thank you so much. That is very, very important message. Now, ladies, if you want to ask a question, so if you're on your laptop, you should see the public chat in front of you. However, if you're on your phone, on the top left, there's a little person. You click there, you'll find the public chat. So go ahead and start typing your questions. We will not be allowing anyone to unmute. So I would really appreciate if you can type any queries or questions you have. Um, I see one on there: is being pregnant without trying to fast simply enough not to fast? So I answered that. Some women can and some women can't. So if she's able to, after the whole assessment and getting things checked, she can. And I was told the first trimester, no extra calories are needed. I answered that. First
Yes,
trimester,
so yes, the first trimester you don't have extra calories needed. However, you need to eat enough to make these organs. So a lot of women don't eat enough even when they're fasting.
yeah,
So they think that one or two meals, and again, a lot of women don't have have some sort of nausea during the first trimester, so they're not able to eat even their calories when they're not fasting. So imagine when they're fasting.
right. Yeah, so whatever they could eat, they would not be able to eat in that first
Yeah,
trimester. And what we just discussed, the maximum development is happening in the first trimester. And even if a woman has hyperemesis and stuff, she needs to get that attention, right? So even if she's having nausea, and maybe not like a specific number of calories, but whatever she can, because otherwise it's your body that gets depleted, right?
that's true.
um what about early in the second trimester when I haven't started feeling any movements?
Again, it's a personalized plan. So if you are healthy and you are nutritionally getting enough calories, if you have enough energy and your doctor cleared you, then you can fast. When we're talking about the movement, it's just an easier way to kind of measure or have a gauge for yourself. So you know that everything is okay. But again, if you're feeling fatigue, if you're dehydrated and your urine is very dark, if you're feeling sleepy, exhausted, headaches, these are other signs that you can also have.
Yeah, right. So yeah, Islamic point of view is the same, Mariam, that if you are able to, you can. If at any point it's risking your health or the baby's health, then you have the ease to not fast. And that, like I
Yeah.
just said, get proper analysis done so you know. Does fasting in the ninth month cause any decrease in the amniotic fluid? Like she's at the وشك
Yeah.
الولادة يعني.
So according to research, it's conflicting. Some research says that it does, and then some research says there's no effect on amniotic fluid. That's why it's difficult to follow just the evidence base because it's inconclusive in a way. So that's why we look at the case itself and we look at her own amniotic fluid. We check with the doctor, and the doctor will give the clearance in that sense.
Mhm. And I did read a study which said that the amniotic fluid is replenished every 4 hours. So if
Yeah.
like a woman, and this is I'm talking at birth. So if a woman she's past 37 weeks and the water breaks, we tell the women to replenish the fluids, right? To drink every half an hour, and you can't do that if you're fasting, obviously.
If you're
So
fasting, it's true.
exactly. So if when it comes to Ramadan, I would not risk it, honestly, especially
On
so
the
close
ninth
to.
month, I wouldn't risk it. Like honestly, that's why I said the third trimester, I would do the seventh, maybe eighth month, but the ninth month, the last couple of weeks, I wouldn't risk it.
Yeah, you don't want any last minute
Because
complications.
you're like Hafsa said, you might get cramps. You don't want to get cramps. You don't know what cramps you're getting. Is it because of dehydration? So I wouldn't risk it on the ninth month.
Right. I agree. I agree. All right. April saying, Salam alaikum. I still have 5 days to make up. I'm around 18 weeks, so you are in the second trimester. I normally have a Greek yogurt with chia seeds and banana, but maybe I should add more to my suhoor. Yes, definitely. What do you
Yes.
say, Aya?
So what I would do, the Greek yogurt with chia seed and a banana, that's a great snack if you're pregnant. But you want to maybe do a sandwich, like an egg sandwich with avocados. You want to do an omelet. Maybe you can have some chicken or a salad with some carbs also. But yeah, that Greek yogurt is great, but it's a snack in that sense.
Yeah, yeah. That's a good. That's a good snack idea. So that thank you
A
for
very
sharing
good
that.
snack. It's a very good snack, very healthy snack. And again, it depends on your total calories for that, like for the whole day, and when you broke your fast to the end. So we have to look at your whole calories also.
True. True. Okay, is it advisable to fast if I already have hypotension? I'm normally at 90/60 without fasting. And last year, without pregnancy, I was 80-50 or sometimes 70-50 while fasting. This time I'm pregnant, quite unsure about fasting. That those numbers look concerning.
Yeah, those numbers are quite low. So I don't think your doctor would even clear you to fast. So if you discuss those with your doctor, they probably will not clear you. And they're quite low. So I wouldn't recommend fasting in that sense. Because
Yeah,
you don't want it to go lower, and you probably need to break your fast at some point if it does go lower.
yeah, yeah, definitely. And we don't want you passing out or something less than
Yeah.
hella. So that is concerning. That is definitely. In fact, even if like in general, without non-fasting, I would really get yourself analyzed with a nutritionist so that you're working on this more closely because that is not normal, right? Adam says, does the fasting depend on the willpower? Um, I guess. I mean, willpower is just like you being motivated to, but you need to have the energy and the right guidelines as well. You
I
can't push
wouldn't
yourself.
really like I wouldn't push a woman to fast during pregnancy and tell her, "Oh, you should be fasting because of your willpower." It's not about willpower. It's about your health. It's about your own medical nutritional status. It's about clearance from your doctor. It's about that pregnancy. So I wouldn't pressure her into saying, "Oh, you don't have enough willpower." She probably could have enough willpower, but she's not clear to do that, you know? She's not clear to. So you don't need that pressure. You don't need that pressure.
Don't decide based on willpower. That's not enough, and
Yes.
that should not.
Yes.
That's not the evidence based recommendations at all, right?
Exactly.
Yes, so April saying she'll add an omelet. My appetite has gone up, so that will be okay. That's good. Yeah, any protein, a good
That's good.
protein and carbs.
Yeah, good protein.
Yeah. Aisha's asking, I'll be around 32 weeks at the start of Ramadan. Okay, so early second, third trimester. Everything's fine as of now. What do you recommend? The fast will be around 12-ish hours. Okay, it's going to be more of a shorter fast, I'd say.
Yeah. So what I would recommend is for you to check with your doctor first. So that would be one. Two, I can't make a decision from just your number of weeks. I would have to look at your blood work. I would have to look at what you're eating, what you're able to eat, your hydration levels. So I'd have to look through all of that. Baby's growth also. So the doctor has to check with that. And then we can decide if you can fast even the 12 hours. Even if it's a short 12 hours, for some women during pregnancy, that's too long.
Yeah. And I love what you said. We need to look at the pattern of the growth of the baby. That is one thing that I should mention as well. That sometimes we don't want IUGR babies, like intrauterine growth restriction for babies, especially
Yeah.
if we can see that okay, your last ultrasound showed this, or even if you don't have ultrasound, they can do the fundal measure and they can see
Yeah.
is the baby growing up on par to what we're expecting. So I would just look at that pattern and how things are going, and yeah, and that brings us to the next point, which is a very valid one. Most doctors would say don't fast without any problems. So this is where you need the right doctor, right? You need a
Yeah.
nutritionist, not just an obstetrician as well. It needs to be both that should be
It
making
needs to
that
be
decision.
both. Yeah.
Aska's asking, can you suggest essential blood work that everyone pregnant should get done before deciding to fast? Is there any specific
Okay.
ones you get?
So definitely I would do like a CBC. I would get your iron levels done, your ferritin levels. So that's how much like stored iron you have. We check your fasting blood glucose. Um, so those would be important ones. Your blood pressure, we need to check
Right.
that. So those are like main ones I would check. Um, you can always check also calcium. So mainly like minerals and vitamins. Those are the main things that I would want to check because those are the main things that we're going to be changing when you're fasting.
True. True. Okay. What are telltale signs that the mother should stop fasting during Ramadan? The mother? Yeah, Aya, you want to answer that one.
I
So,
would number one, if you're feeling extreme fatigue, headache, um, like you're fainting, nausea, extreme nausea, if you're starting to throw up, if there's any diarrhea, anything that would cause dehydration, you would want to stop. And if you're feeling very tired or dizzy, definitely stop. So someone like had like the low blood pressure, something like that. If you're feeling like your blood pressure is going down, you wanna break your fast.
and you mentioned
And I
today
think
in the
as
talk.
women, and I think as women, we're very smart at knowing. when is something not bad, especially when you were pregnant. It's like your body kind of connects to what's okay and what's not okay. SubhanAllah, like you start knowing your baby even when you're pregnant. So you will know. I think most women will know, and don't try to push that idea. Like if you feel off, break the fast. Don't push
Yeah.
yourself. Don't think, oh, I have enough willpower. Oh, I'm stronger than that. No, if you don't feel okay, just either go to like the emergency or stop the fast and then maybe check with the emergency, check your blood sugar, blood pressure, and so on.
Yeah. Like you said, I love what you said. You like we connect with it. I call it the intuition, your instinct, right?
Yeah.
Your gut feeling, you would know. I mean, I think that's as a mother, and that is the moment you know you're pregnant. You're just that motherly instinct is one of the most strongest instincts in every aspect. Like I've
In
seen it
every
with
aspect.
yeah, like Mashallah, you're a mother now, I'm a mother. We can sense if something's off. Like even if our
Yeah.
child's not in the room, right? I don't know how to describe it. You can't describe motherly instinct. That is it. You just know
Yeah.
it. Subhanallah. So yeah, please listen to your body. I feel that that part's very, very important.
Yeah.
Um, and what you mentioned today earlier in the talk as well, like darker urine, those that would be a sign of dehydration as well. That's a very important one. Yeah, so that answers April's question, like nausea and should you stop? Yep. If your word nausea would come again, that's a sign. That's just what she just
That's
said.
a
And
sign.
that
Yeah.
yeah. And I was like, I breastfed my elder one and kept fast, and after having I vomited out, but you managed to keep all fast. Well, that's fine because that worked for you and your body. So that's alhamdulillah. I mean, that's good. But I would be careful and just get things analyzed just on the safe side because we don't know how. This is what I always say about pregnancy nutrition in general is that I see that whatever nutritional decisions mamas make in pregnancy, and this is in general outside Ramadan as well,
Yeah.
the outcome or the result of it is never immediate. It's more towards the end. And sometimes, yes, complications start showing up if the mother's not having adequate nutrition. So we might not see the implications immediately, but on the longer run, we don't want it like last mahalla causing any issues for the mother and especially pregnancy where the little one is dependent on what mama's taking and it's all being passed through the placenta to the child. All right, I think that is all of the questions so far. If anyone has any more, please shoot them in here and now. I will be
I
uploading
want
this
to
recording.
add, I want to add just one last thing. So usually in the third trimester, your nutritional needs are much higher, and a lot of women start having like anemia or iron deficiency during their third trimester. So that's why it's also, we have to look at that. And that's what you were, because that brought me to the idea where you're saying we don't know what happens. If she's under eating in the first trimester and second trimester, it could show up in the third trimester. We never know. She would think that she's eating enough. So you want to think, when I'm fasting this month, you want to do your best with your nutrition so it doesn't affect the other months. So that's something to kind of keep in mind.
That's a very good one, especially anemia. I feel there's not like when women show low iron profile levels and
Yeah.
stuff in the trimester, they need immediate measures like iron infusions or even transfusions, right?
True.
It needs it. And then when you look back, there is a lot of like there was not enough nutrition guidelines or supplements taken which were needed. Best is of course our body absorbs it better through foods, but the result does show in the third trimester, and you just confirmed that. How can you reach out to Aya? So Aya has if you saw that the ad on my Instagram, I've tagged Aya on it. Otherwise, what I'll do is I upload this and I share it on the events group. I will send all her details. Basically, I think they can contact you on your Instagram. So how do you want them to reach out
Yes,
to you?
they can contact me on my Instagram. My clinic's number is on there. And yes, we do online consultations and follow-ups, and we do it in the clinic or online also. So yeah,
Perfect.
completely available in every way.
Yes, excellent. Alhamdulillah, that's good. We need that. We need on fingertips. Like now, it's the post-COVID era. So now I like to refer
And
the world
also,
as
like a lot of women who are pregnant don't want to be driving or coming to the clinic most of the time. So even a lot of them are in Kuwait and they're doing it. I have a lot of women postpartum that don't want to be driving or going anywhere. So those are like at home and we're doing it online.
I think, yeah, it's true. I'm thankful to this online world. I mean, however scary it sounds, but I do my groceries online. Malikhal, I just don't want to go and just
Yeah.
put it in my. I like them delivered on my doorstep. I'm that person now. Uh,
As a mother, you want to get all the help you can.
Definitely, and there's no shame in that. Is
There's no
perfectly valid.
shame. No shame.
We should, and like we want to make life easier. Never make it harder for yourself. Subhanallah.
Yeah.
And literally, it's like when I look at it, you and I being millennials, how the world was as we grew up and how much it just changed. It's just
Yeah.
subhanallah scary.
And keeping up with all of this isn't easy, but yeah.
Keeping up with all of this, right? But I'm thankful to the online. I mean, you're in Kuwait, I'm in Kuwait. We haven't met in years, right?
Yes.
So thank you to online that we got to
Thank
meet
you
each
for the
other.
online. Yes. We can communicate and be always connected. Yes.
Yes, definitely. One question popped up: is kefir safe?
It shouldn't be an issue unless you have gut issues. Sometimes for some people, if they're not used to having kefir, it can like cause some bloating and gut issues. But if you're used to it and you drink it anyways, then it shouldn't be a problem.
And if anything, it like for in general, it's supposed to be good. It's like a
Very good
probiotic.
because you do need like healthy bacteria and the probiotics during your pregnancy and even without like being pregnant. So it's a very good natural source of probiotics.
Yeah, very good question came up. Caffeine and pregnancy. Just a
Caffeine.
quick. I would love
So
you to.
with caffeine, we don't cut it out completely with pregnancy. You are allowed, but not more than like 200 milligrams. And I would do less sometimes. So 1 cup a day is fine. 1 cup should be enough.
Right. I never drank tea in my life. You know that. So I don't know
Yeah.
how that works. So yeah, subhanallah. Right. Excellent. Yeah, if it helps your digestion, why not? In fact, any good
Yeah.
gut foods are good. Yeah. Excellent. Yep. Thank you so much. And really, really like a heartfelt thanks to you, Aya, for being here
Thank
today
you so
and
much
giving.
for having me.
No, wallah, it means a lot. And I will definitely be sharing Aya's contact details for all of you that are pregnant and have not educated yourself yet. So I'm just shooting about my childbirth education classes. I'm not teaching in Ramadan at the moment. It's my time to reconnect and take a little break. So I will, but I have the signups registration started for the course that is right after Ramadan, inshallah. So we will be covering all of these topics that you see on the screen, and you can register from now if you want to take. And I see lots of my moms who are currently taking these classes, so do sign up. Don't delay it. The better you are giving yourself a good start when it comes to good nutrition, exercise, making the informed decisions, having your birth plan ready, preparing yourselves for all birth outcomes. It's very, very important. And I do include the free VBAC component as well because I'm a VBAC mother myself. And this is all that I'm offering. I have the specialized workshop, but I'm not doing any workshops at the moment. All of these are available recorded. The only one I'm doing is tomorrow is this one, which I want to draw your attention to. So if you're breastfeeding and you want to fast, so this is the one I have it is a paid workshop, but it has lots of freebies. Like I have a constant WhatsApp support group and a recipe book that I've put together for lactating moms. So this is happening tomorrow. So if you or anyone around you is breastfeeding and wants to know, wants this guidelines about Ramadan while breastfeeding, so as a lactation professional, this is one of my favorite workshops I do annually. So I hope to see you guys there, inshallah. And yep, that brings us to the end of today's session. I am glad you found it beneficial. Jazakumullah khair, everyone who stepped in and whoever is watching the recording as well. I've in the YouTube description you will find Aya's contact details and mine as well, and I will be sharing it in the groups as well. All right. Thank you so much. Please don't forget each other in du'as during this blessed month. Prayers, du'as are very, very special. Same goes to you, Aya. Please pass my regards to your family. Lovely to have you here. And thank you so much. And I really think we should make a point to meet in person as well, inshallah.
Yes, we.
Thank you so much.
Take care. Bye bye. Thank you. Bye bye.
وأنتم جزاكم الله خير. السلام عليكم ورحمة الله وبركاته. All right, I'm going to end this now.